Hi, my name is Dr. Steve Hough. Welcome to Hough Orthodontics. So a lot of people wonder, what is TMJ and do I have TMJ? TMJ is really the abbreviation for the temporomandibular jaw joint. And so when we talk about TMJ, it's the jaw joint not functioning correctly. And a lot of the symptoms that go along with that are commonly headaches and ear pain are probably the most common. Also popping and clicking in the jaw, muscle tenderness, but it can also lead to things like ringing in the ear, shoulder and neck pain, even blurred vision at times can be associated with TMJ. You might not know if you have TMJ, but it's a good idea to come in and get it looked at because we can see what is going on with your teeth and your bite that affects what your jaw is doing. So many people will come in and they'll wonder, what caused my TMJ? And as we look at the teeth and the bite, we can see that there's a shifting in the bite. And what my understanding is that it's probably been there for a long time, but they just haven't had the symptoms. They didn't show up at that point in time. So there's an underlying cause usually that's there for the TMJ to flare up. It's a bite problem, the jaw's shifting. And then a life event would happen where sometimes they bite down on something the wrong way, or they step off a curve and clench their teeth, or maybe they get a filling changed, and it just affects the dynamic of the way the teeth and the bite and the muscles work together. And it throws it off into a spasm, and because it's never able to rest anymore, because the jaw is out of position, it goes into what we call a pain cycle. So the pain causes muscle spasms causes pain, and then it just becomes a vicious cycle and it doesn't go away until it gets fixed. We have a lot of people that come to us for the TMJ, but they've been to the ENT, they've been to all these different doctors, the neurologists, and they really haven't had an answer. Primarily because people don't know about TMJ. They're not aware of what TMJ is and the symptoms that it can cause. So we're grateful by the time they get here, they've explored a lot of different options, but we're able to determine whether it is TMJ and then explain the different treatments and options. And I think they find it really relieving when they see that there's a way that this can be treated instead of having to live with it their whole life. There's a great relief that comes on their face. And when they start to see the results, they're very grateful, I think. When you're living with pain all your life or for such a long time, constant headaches, you really get beside yourself. You're not operating the best way. I had a patient probably say it the best not too long ago when he started feeling better. We were treating for his TMJ and he said, it's really about the quality of life. I can tell my life is so much better now that I don't have these headaches and jaw pain anymore.